Hi everyone, I'm Marina Kurian, and it's my pleasure to be the chair of weight loss medications and how I use them. My co-chair is Teresa LeMasters, and she is the president-elect of the ASMBS, or actually the president-elect of the ASMBS, and it's going to be a great session. We have several ASMBS members who are ABOM certified, like John Lescott, Faraz Hussein, and Joe Northup joining us. We also have Latanya Four and Rika Mittal, and I look forward to all of their discussions today. My job, one, is to welcome you, and two, is to go into ABOM certification and why I think it is important to use or to obtain that. And there are a couple of reasons I think that you should take it. And let's see if I can get this to go. These are my disclosures. They are not relevant to this talk. And first you have to ask yourself, is there a need? I clearly thought that there was. There's a need for a variety of different reasons, right? So we have patients who are supermorbidly obese that need some preoperative weight loss or a mandated 6-month diet. I generally don't put everybody on weight loss medications beforehand, but there's some patients that are like, I would love to jumpstart this. And is there something that you can prescribe to me, right? So their need is in the pre-op arena as well. For our post-op trajectory, I tend to watch how these patients do, how much weight they've lost in between their follow-up visits. And I can see when they're starting to fall off a little bit, and I want to boost their trajectory. So I don't always wait till they're a year out. I will sometimes put them on medication when they're struggling at the 6-month mark or the 9-month mark. In addition, I have patients that come in, they're like, I came, my doctor said I needed to have weight loss surgery, but I really want to try some medications. I don't really want to have surgery. I have at any given time 4 or 5 of these patients doing their monthly visits with me. So a few things. One, the patient gains familiarity with your practice, with your staff, with you. 2, they spend a lot of time in the waiting area because I might run behind a little bit in the office. So they spend time with other patients and sort of like a support group, and they end up hearing positives about weight loss surgery. And so sometimes I'd say about 60% of these patients will change their mind and become surgical patients as well. And then, of course, with obesity being a chronic disease, and you're going to hear about weight regain after surgery or recidivism, and it is something that we all face and have seen in our patients, even the patients that have done exceedingly well. It's just one of those things that with the chronicity of obesity, we are all expected to see some return of the disease, and it's wonderful to have an option to offer patients that's more than just Phentermine or giving them another option to try and get them to lose more weight. But can't you just go out and do this yourself? Like, do you really need the certification behind you? I would say yes, and here's why. I thought it's fine if I have one patient on a Phentermine and I have somebody else on Qsymia and I have another patient on Contrave. But what about that patient that I started layering a lot of medications? And I have some patients that I have on 3 or 4 meds. And at the first patient I had like that, I thought, the ABOM had just come out, and I thought this is a great time for me to try and do this certification. So one, you'll learn more about obesity. You get it from different perspectives, from the perspective of someone who's a hepatologist or an endocrinologist, someone who deals with adolescents. And so you have a different perspective than you do taking care of surgical patients only. So as well, endocrinology, et cetera. So you gain an insight into their guidelines and what they are doing to treat patients, as well as there are some syndromic things in some syndromic groups in the treatment of obesity. and you will look at those patients and be like, oh my God, I totally have taken care of a patient like that, because that's happened to me as well. So I think your perspective broadens. You gain comfort with prescribing the weight loss medications because you know what the interactions are. You've read about their mechanisms. You do get a more in-depth look at the medications than you would if you were just prescribing them yourself. And then the most important aspect is layering the medications. As I said, I had the first time I looked into it was when I started putting a patient on Kisimia, Belviq, and then I added a GLP-1 agonist. So some of it is off-label. I just wanted that ABOM certification behind me. It showed that I had a competency in obesity. So what are some of the application criteria? You had to have completed a US or Canadian residency. You have to have an active license in either the US or Canada. You have to have active board certification. In addition, you need to do 60 hours of AMA Category 1 hours on the topic of obesity. And this is over the past 2 or 3 years. And you can get those from review courses that you take, from the ASMBS meeting, and also the TOS and OMA meetings as well. An interesting thing that came up once I started doing a lot of weight management with medication is that I actually saw a decrease in the number of revisions. So that could be good or bad. I thought, you know, I was seeing probably doing about 2 revisions a week, and now I do 2 a month maybe. And but when I looked at the numbers, my revisions actually decreased per year by about 30%. What does that leave you time for? Well, it's far easier to do a primary operation, right? So it left me more time to do more primary operations. And the revisions are so complicated, so I was doing less of them. And in addition, as we know, revisions can be fraught with the greater risk. So I have a little bit of less risk in my practice, so that's good. From a training aspect, the ABOM really came about because they wanted to increase everyone's expertise on obesity, because so many of us doctors have really no expertise in obesity. And what they've established is a competency in obesity treatment. And it allows you also to train your staff. So I have an advanced nurse practitioner with me that I have helped train to treat some of my patients when I'm not available to take care of them. And it also allows you to grow your practice. So I have about 20% of my consults are really just straight for medical weight management. So for all of those reasons, I would encourage you to go to abom.org and look at the criteria, think about signing up. I think it does help everyone's practice, and it gives a really well-rounded approach to your patient, especially if you don't have a obesity medicine specialist in your practice. So you would become a diplomate of the American Board of Obesity Medicine, or because you can become ABOM, as I like to say. So those little letters go after your name as well. So thank you so much, and I hope you really enjoy the session. And I'm going to leave it to our next speakers. Thank you.